Hi, everyone. Nice to see you. So today's session is titled Trauma Informed Response, but I will be also taking you through some of the other aspects associated with our responses to a humanitarian crisis. And I'd like to, right off the cuff, um, acknowledge that a lot of the material that we'll be covering today have been put together by other facilitators and colleagues, namely Chitra Venkatesh, Dr. Chitra Venkatesh, Dr. Shobha Nair, and our friends in the US, Dina Joseph and Jesse Humphreys. And we've all worked on this at separate points. And I've drawn from whatever I thought was relevant for today's session. And I'd like, because we don't have a case presentation, we have a lot more time on our hands. So I would encourage you all to leave your comments in the chat box and make this a more interactive session. We will be taking up those comments from time to time. Raju, I'll let you know when I'd like you to summarize from the chat box, please. So
Sure.
I'm just going to start off by sharing my screen. Okay. So is my screen visible?
Yes, ma'am. You can move on to share screen.
All right.
Yeah.
Okay, just to let you all know, I'm taking the session from a much noisier place than I usually do. So if there's any ambient noise, Rajlakshmi, just let me know. Okay, so trauma informed response is basically an area of working in humanitarian crisis which recognizes our frailty as healthcare providers. So the trauma that we speak of today is not so much the trauma of the people that we care for, but the trauma that we ourselves experience when we do the work that we do. So I'd like you all to take a few minutes and really focus on the pictures that I'm sharing on my screen right now. These are pictures from the Kerala floods of 2018, 2019. And on the left of the screen, you can see people moving a bedbound patient through waist-high floodwaters, trying to get him or her to safety while covering her, making sure that she's not um, getting soaked in the rain. And on the right of the screen, you can see people rescuing children in what appears to be a large cooking vessel. So these are all real pictures of things that have happened in our recent lifetime. These are not pictures from stock photos or things that happened a long time ago. These are pictures from the Nepal earthquake that took place a few years ago. And if those of you who live in the mountainous regions, I'm sure that you also felt the aftershocks and the effects. And in Nepal, particularly, the devastation was devastating. I mean, it was not just in Kathmandu city, which is a very crowded city, but also in the far-lying reaches of the mountains, where entire villages had been completely annihilated. And we have reports of people who we never heard from again because the evacuation teams never made it there because of the terrain. These are pictures from Assam and Kerala again. And these are things that happen in our country on a regular basis. I mean, those of you who are here from the Northeast and from Assam know that this is a yearly occurrence. And every year, the scale of tragedy is massive. And sometimes it is compounded, not just by the natural aspect of the disaster, but also by the socio-political aspects that people have to experience while the natural disaster is underway. These are scenes that have become quite common now. People getting ventilatory support for COVID. And there are far more distressing pictures than these, but I'm not going to share those. And I'm going to ask you to really look at all these pictures closely and examine how you feel when you're looking at these pictures. Last rites, disposal of bodies during the pandemic have been a huge issue of contention. We don't get to be there to perform last rites for our loved ones. We don't even get to say our goodbyes to them. We don't get to touch them. And usually last rites are carried out or the disposal of bodies is carried out by people who have no connection to our families. And they're done in a very clinical way. This is a cremation ground where multiple funerals have been happening at the same time. And of course, a spin-off humanitarian crisis that happened with COVID was the migrant workers crisis. The largest internal exodus of human beings in recent times. The largest internal refugee crisis to happen in recent times. And you can see children, old people, everybody was affected by it. The photograph on the right of the man weeping into his phone was one that came out in the news circles. And I remember being particularly distressed by this picture. Because I remember, if you remember the story, it was of a man who was trying to make his way home and his wife was pregnant. And he didn't know if he would get there at all, if not in time. So I'm going to stop sharing for a second and let these photographs sort of land with us for a little bit. And I'm just going to invite some comments as to what looking at these pictures made you all feel. Some of you are frontline workers. Some of you have taken on peripheral roles, but these are all things that have happened in our country and in our neighboring country. So what are some of the emotions that emerged in you as you watched these, as you looked at these photographs and when you saw the faces of the people in these photographs? We'll just take a minute to let the answers start coming in. I can see Sandhya saying disappointing and disheartening. We have to put on a brave front and do what has to be done. The operative word being front there, Rajni. Humanity needs to stand in unity. Yes, we do. We've seen the best and the worst of humanity in this last year. What else? Were any of those pictures particularly striking to you? Deeply distressing and disturbing. Helplessness, yes. There's a lot of helplessness that we feel. Yeah, it was a sad aspect of the pandemic that we witnessed in India. Elsewhere in the world, nothing of this sort of pain, yeah. A lot of it comes down to mismanagement. A lot of it comes down to bad planning. And a lot of, I think, what we saw, what you said, John, is what did happen in other parts of the world, which goes to show that it was unnecessary. And when suffering is unnecessary, it is even worse, because we know that it was avoidable. Realization about lack of cohesive support, yes. Parul says that the last rites were most touching. Yes. So particular picture of the man talking on the phone is due to mismanagement and not allowing people to cross borders and reach home, yes. So there are different kinds of disasters, right? And through Joan and Atul's presentations, we've talked about the different kinds of disasters and the different kinds of responses to the disasters from a logistical point of view and from the point of view of organizing a system in order to meet it. But what we're going to talk about today is the impact on us personally as individuals, and that impact on us as individuals that in turn affects the organizations that we work for and the systems that we are part of. So that's what today's session is about. It's about recognizing and acknowledging that we as healthcare providers are also subject to this kind of trauma and this kind of pain when we watch our fellow humans in pain. And yes, small gestures can make a big difference. And Parul, one of the things we noticed during the migrant worker crisis is that the best civil society came forward. People started coming forward in clusters to try and, get food, get clothes, get something across to these people who were really left with nothing. And that's one aspect of humanity that has come shining through. And even when you saw that picture of the people carrying the bed-bound patient on their shoulders through that much water, or even trying to get children across to safety using whatever they could get. While I feel sad when I see those pictures, I also feel that there is a ray of hope that humanity is still intact. And even if systems can't organize themselves to come together, we as human beings still can band together in a cohesive way, like somebody mentioned, in order to meet the challenge. And not knowing how to reach out, how to plug into the system is a big problem, Vandana. Yes, that's absolutely right. So I'm going to go back to now the presentation. Okay. Raju, is it back on track?
Yes, it is.
Okay, great. So one of the things that we're going to talk about first is our distress. And what does it mean? Like all of you have expressed the pain that you feel, the distress that you feel in seeing some of these images. And I know that many of you have been part of these responses as well. So the distress is even greater. Now, I've borrowed these upcoming 2 slides from Dr. Chitra Venkatesh's slides from our Pali COVID Echo session. So some of you who've attended those sessions might find these familiar. How do we recognize distress? Now, there is a spectrum of reactions to a particular situation. There is a healthy response, there is a reactive response, there's an injured response, and then there is a kind of response that indicates that all is not well, that we need further help. And so what this slide really shows you is how we sometimes oscillate on that spectrum. It's a sliding scale. And sometimes we might find ourselves on the greener side of the spectrum, which is a healthy response, where in terms of mood, we have normal mood fluctuations. We're calm usually. We tend to take things in our stride. These are manageable emotions. And for most part, we're able to handle things calmly. But then if things start getting worse, we find that we might be getting irritable, nervous, we're sad, we start feeling a bit overwhelmed by all the stuff that we're seeing around us. And then after a while, how many of you have felt anger at what you were seeing? I'm sure people have felt anger at the inequity and the disparity around us, or the fact that the system was not actually organizing itself in a way that was humane. And a lot of us, I think, sometime in the course of the pandemic have felt this. We felt sad at the state of the world. And some people have when it's been too hard to manage, it has gone on to the red side of the spectrum, where you might find that you're getting angry, that your behavior is getting a little bit more aggressive, you're behaving out of character. When you're normally calm in particular situations, you find that you're losing your patience. And some people even go to the extreme of getting absolutely depressed and have suicidal thoughts and ideation. So similarly, there are different things on this slide that you'll see. For example, I'll sleep patterns. Normally, if you're a healthy sleeper and you have no trouble falling asleep, you've had a long day at work, and then you find sleep comes quite easily to you. But then as you go further down the spectrum, you start having trouble sleeping. You find that you can't go to bed as easily as you used to. And when you lie in bed, oftentimes there are intrusive thoughts about what might have happened during the day, some of the conversations that you might have been privy to, some of the news articles that you've read, or some of the things people have said in your work setting, or things that even our leaders of our country are saying. And those are kind of things that keep you up at night. And that progresses slowly into very restless and disturbed sleep. And eventually it can get into a space where there's either you have insomnia, or you find it very hard to get out of bed, and you find that you're sleeping a lot more than you should, and so on and so forth. So there are various things. So we talk about sleep, we talk about being socially active, and how your normal levels of socialization. How many of you have felt the disconnect or the withdrawal from even meeting your, of course, there are restrictions on meeting and stuff, but even in your interactions with people, you don't feel like having that phone conversation with an old friend. You're too fatigued to really engage in social interactions. You find that perhaps there's so much going on in the world that is wrong that I can't make small talk with somebody. And there's avoidance of social engagements. You don't want to do that Zoom call, even if it is with your family. And finally, you reach a point where you don't even want to pick up your phone. So there's social withdrawal, and of course there is substance use and addictive behaviors that come to the forefront. It's one of the biggest fallouts of unmanaged distress, that people develop substance dependence and so on and so forth. So this is just sort of a sliding scale of how people might react in different distressing situations, and how, as the distress gets compounded, then our regular patterns start becoming more and more maladaptive. And like I said, it manifests in different domains. It might manifest emotionally, physically, behaviorally, and we as human beings, we cannot compartmentalize all of this. What affects us emotionally or will affect us physically. Something that affects us mentally will have impact on the way we interact with people in behavior. And so some of the common manifestations of psychological distress on an emotional level could be feeling overwhelmed, anxious, sadness, just a low mood, like throughout, not being able to snap out of it, difficulty in concentration, loss of interest in activities. Physically,
Anji,
you might find that your heart rate is increased, you're restless. Many of us experience distress in our gut, and we find that we're not able to eat healthily, or we're eating but then our stomachs are upset. So different people, physically, distress manifests in different places. Some of you might have constant headaches, some of you might feel constantly tired. Difficulty sleeping, of course, is something that all of us at some point or the other have experienced. And behaviorally also, we find that the way we interact and connect, or the way we conduct ourselves, we might become more aggressive, we might become more less keen on interactions, and so on and so forth. And what distress can also do is it can worsen pre-existing symptoms. If somebody is prone to mood disorders, that gets worsened. Chronic health problems get worsened. And like I've mentioned earlier, you could have an increased use of alcohol, tobacco, other substances, which up until then might have been just restricted to the occasional social, interaction, and so on and so forth. And red flag signs that we need to watch out for is agitation, confusion, disorientation, substance use, of course, if it gets excessive, hallucinations, delusions, and suicidal ideations. Now, these are extreme things, but they do manifest, and if they do manifest, then we need to be very wary, and that's something that definitely requires professional help. So that's just a quick overview of how distress can manifest. Now, I'm going to ask you to think about, you're all caregivers in some way or form, and what has changed for you since the pandemic started, right? Caregiving in normal circumstances versus in a crisis. And some of the things that we've had to contend with is that the pressure of time is tremendous. What we had a long time to do, now everything is urgent. Everything has to be done at a particular pace. We don't have the luxury of time anymore. In many countries like ours, and in many settings within our own countries, there is a variation of the resources that are available. Some places are better equipped, some places are not. Some places, the sheer terrain makes it difficult to access resources. There are disrupted communication channels. And I don't just mean in terms of logistics. I also mean in terms of leadership, right? Now, who's taking charge? Who do I speak to if I have this problem? Who is going to take charge of this particular aspect? And regular channels of communication are also disrupted. And generally, we're working in a much more stressful environment. So I'm going to just stop again for a minute and ask you, what difference have you seen in the way you provide caregiving now as opposed to last year this time? Oh, I can see lots has been going on in the chat box.
Yes,
Amla,
ma'am.
thank you. Some very valuable points. Yeah.
Rajani have talked about the usage of PP kits and all. Do make you want to become a social outcast there? So you feel irritable, frustration, mental fogging, and anger at people who take basic precautions for granted. So they are increasing frustrations there. Avatar have said that caregiving has a new meaning now.
It does indeed. Yeah.
And Rajini have commented like there are pressures with working on fewer resources now, like fewer new nurses and all.
Yeah, I can see that that there's a vast range of responses here, and I can see that people are very well acquainted with stress. Obviously, having been care providers as well as going through it yourself, and serious complications due to uncontrolled diabetes, hypertension. People have been negligent and not following lifestyle changes. Yes, we also saw that a lot of manageable conditions became relatively life-threatening ones because of access issues, because of restrictions, because of just the focus has been so COVID oriented that a lot of other things have been sidelined. And one of you has mentioned no access to cancer, can't visit cancer wards now. Yeah. So what does that mean? It means that we are not there to be able to provide the kind of care that we earlier could. And so there is a collateral damage to people with pre-existing conditions as well. And trying to cope with colleagues falling sick. That's a really, really big one. And one of you mentioned that, the frustration at seeing that even basic precautions are not being followed. I find that terribly difficult to come to terms with, especially being from the healthcare fraternity, when I know that so many of my colleagues have suffered, so many of my colleagues have fallen ill. And then when I go out and I see that people are not following the basic precautions, it really, really makes me angry. And the thing is, I can't take it upon myself to go up to every single person and say, hey, what are you doing? You're putting other people's lives at risk. And that sort of, I feel that sort of frustration and anger building quite often. And recently I was on a flight after a very long time, and I was appalled at the level of, lack of consideration for people around them. So yes, we've got various things that we're dealing with right now, but let me ask you, in your particular settings, can you give me an instance of what is something that is vastly different from what you were able to do 9 months ago, 10 months ago, a year ago? Something that has changed for you personally. Because there's a lot of description of what is happening around us, but I'd like to just hear from you what has changed for you at an individual level. Has your ability to give care changed? Has your attitude towards yourself or to your own profession changed? To go out without a mask feels liberating, yes. Touch is not possible. Touch is a big one. Yes, it's a big one. I've realized I can stretch myself. Yes, a lot of people have realized what they're capable of. Not being there in person and relying on the telephone, not being able to read nonverbal cues, which we as therapists especially rely on a lot. Non-COVID patients have been falling through the cracks. Yes. Adjusting with online counseling. Yeah. We're going to look back on this time and a whole new bunch of protocols are going to have been, would have been drafted. I miss hugging our children and parents. Yes. Very cautious when someone comes close. Nobody wishes to invite friends home. So there's a social breakdown. The medical world has changed. AI has become the order of the day. Yes, we're seeing this massive infusion of technology in our workplace, in our own lives. I mean, the amount of technology all of us have had to scramble to learn is staggering. So yes, I'm going to come back to the chat box in just a bit, and I'm just going to go back to our PowerPoint right now. So I can see that this has affected each and every one of us in different ways, individually and systemically. And so caregiving as we know it has drastically been altered. Now, in a humanitarian crisis, there are possible psychological syndromes for healthcare providers that healthcare providers might experience. And I'm just going to, it's a fairly comprehensive list, and I'm just going to go through each of them slide by slide with you. The first of these is burnout. Now, burnout is experienced also in non-pandemic times. I'm not discounting that. Many of us have felt burnt out even in different times of our career. So it's not necessarily something that is specifically associated with the pandemic. But now in the pandemic, burnout is taking on a new, it's a whole new beast. And what is burnout really? So burnout is characterized by loss in three domains: a loss of energy, a loss of compassion, and a loss of efficacy or efficiency. Now, how does a loss of energy translate? You might feel exhausted, emotionally and physically depleted. You might find that you distance yourself from work and people because you just don't have the energy to face them. As much as we are compassionate people, we are not all superhuman, and we do find that compassion fatigue is something that we experience. And when we lose a sense of, and I don't mean we completely lose it, it's just that we're so depleted that we start feeling like, we can't draw on those reserves of compassion. That results in apathy, cynicism, depersonalization, where we end up objectifying people. We have excessively detached responses, where it's a coping mechanism, and our detached responses, we start focusing on the task rather than the person. And there's also an increased sense of irritability. When we lose efficiency and efficacy, we find that we become a lot less ineffective at work. There's a lack of accomplishment. What's something you could do quite easily in the past, now it becomes a struggle. You find it difficult to meet deadlines. There's a lot of procrastination. Like, I personally have found that to be true, where if I'm so burnt out that even the smallest task becomes a mountain for me to climb. And I find that same task, which would normally take me 10-15 minutes to finish, just sits there on my desk for at least a week. And it also affects our judgment. And we have boundary issues at work, right? We're unable to set boundaries, and sometimes our emotions get the better of us. And those boundaries with our colleagues, with our authorities, within our own families, they become a bit blurred. And generally, there's a sense of low morale. And these are some of the the typical characteristics of burnout. And have you felt any of these things in the past many months? Scary to see black and white terms. It is, but these things do exist. We're all becoming more robotic. Yeah, definitely becoming more robotic, and that is something that has been foisted upon us. And judgment and boundaries are blurred. Yes. So these are things that all of us recognize. And I think what we need to recognize these as they could be signs of burnout, and we need to pay attention to it, because as these things get escalated, they only get worse. And we might reach a point where recovering from them becomes a far bigger challenge than if we address them as we start noticing that these things are happening amongst us. Prasanna says it is suffocating and unable to make others understand too. The thing is also that so many of us are experiencing it at the same time, that there's a breakdown in communication between us. If I'm at a loss of energy, if Raju has lost her energy, then Raju and I are unlikely to talk to each other. And that sort of makes the problem even bigger, because she and I have to work together every day. Normally, we our work that the two of us do, it converges over several hours in a day. And if she and I are so depleted energy-wise that we don't find it in ourselves to talk to one another, then we find that the work gets worse. And then the challenges then get more and more compounded. So while we need to understand one another, we also need to recognize that the other person might be suffering, that someone's incompetence, sudden incompetence, may not be incompetence. It might very well be that they are so stretched that they're not being able to do the task the way they would have otherwise been able to do. So that's when we need to bring compassion into the picture. But what happens if burnout makes us lose our compassion? So it becomes a very, very vicious cycle. And therefore, it is necessary that we as team members recognize this in one another as early as possible. Okay, so how do you recognize emotional exhaustion? Now, these are questions to ask yourselves. Do you dread going to work? Now, it says walking into work, but obviously this was done at a time when this particular phrase came in before the pandemic. Maybe not all of us are walking to work. Some of us are just dreading getting on that Zoom call. And recently, someone sent me this little meme on WhatsApp, which said that impending sense of Zoom instead of that impending sense of doom. So, do you dread your next Zoom call? Do you hate the thought of a handover and getting started? It's your turn to take on that routine. Have you noticed that you aren't motivated to work, or simply don't put the same amount of time and energy into things that you once did? These are questions to ask ourselves. Are you feeling these things? And if you are feeling these things, it could very well be a sign of emotional exhaustion and a sign that you need to give yourself some attention. Apart from burnout, here are some other very common experiences that we have: grief, post-traumatic stress disorder, depression, and anxiety disorders. Now let's take them one by one. Grief, and this is something that happens a lot. We confuse grief with depression. People are very quick to say, oh, this person is depressed. It could just be that that person is grieving. We have all lost something in the course of the pandemic. All of us have lost something in the course of the pandemic. For some of us, it could be we could have lost loved ones. For some of us, we've lost friends. Some people have lost their jobs. Many people have, all of us have lost our sense of freedom and our loss of social connectedness. And these are things that we grieve over. Grief is not just for the loss of a person's life. Grief is also experienced when we lose something that we value, and we value many different things. How many of us really loved and found our rejuvenation in travel? And we can't do that. So even if you have time off from work, you're confined to your own home. And it is something to grieve over. There is an increased emotional intensity. But the one thing about grief is that your self-esteem is not impaired. That is a defining factor between what grief and depression, where the difference lies. Post-traumatic stress disorder is a phrase that we've heard a lot. It was coined during the post-war era and was really recognized in veterans of war. But this is something that is applied to all of us. And PTSD is characterized by persistent and frightening thoughts and memories. You might have seen something or experienced something that really traumatized you, and then you just can't stop thinking about it. Every time you have a moment's silence, that image flashes in front of you, or that sense of fear grips you. I was in a car crash in January, early this January, and it was a terrible car crash. I mean, all of us walked out of it all right, but for the longest time, I couldn't get back in a car. And there were many times in the day, in the middle of lunch, if I just closed my eyes, it was that image that actually flashed up, even though nobody was talking about it. And those are signs of post-traumatic stress. Behavioral effects like substance abuse and breakdown in relationships, and even thoughts of suicide or actually attempting or committing suicide, all those things happen. Actually, committing suicide is the wrong way to put it because it sounds like a crime. So people taking their own lives is a fallout of PTSD. Depression, again, not to be mixed with grief, not to be mixed up with grief. Anhedonia means a loss of sense of pleasure. You don't take any pleasure in any activities. There is disconnection from everything, and low self-worth is a defining feature of depression. People have difficulty thinking, they have difficulty concentrating on things. There's a lot of guilt. And very often when people are depressed, when it's not understood as depression, people around them might tell them, maybe you just need to exercise. Maybe you just need to get some fresh air. And they sort of trivialize or diminish the experience of depression. And this might result in a sense of guilt in the person saying, okay, why am I not being able to snap out of it? Why am I not being able to get out of this? And so that is a characteristic trait of depression. And anxiety disorders, which also happen in other situations, can come to the forefront at this time, where you have repetitive thoughts and obsessions, panic attacks, this very vague, ambiguous, but unshakable fear, and also compulsive behaviors, checking the locks of the house, checking the doors, uh, maybe washing your hands repeatedly, so on and so forth. I mean, I know we're now advised to wash our hands repeatedly, but this is beyond that. So these are some of the other ways in which we see distress manifesting. But some of the more unique stressors in a humanitarian crisis, and again, please remember that when we talk about humanitarian crisis, we're not just talking about COVID, we're talking about any kind of humanitarian crisis. One of them is death and loss. The scale of death and loss that we see is unlike in normal times. And very often in the healthcare system, majority of the time, death is framed as a failure. We see death as a failure. Very few disciplines like palliative care don't see death as a failure on the part of the person. And usually that sense of failure is something that the family imbibes or the patient imbibes. Now, we also see a lot of unnecessary death of those who may not have died had they been in alternative locations, times, situations, or had they had different resources. So death and loss, the way they happen, the scale at which they happen is different in the time of a humanitarian crisis. Our own personal safety is at stake. Some of you talked about PPEs. We saw this happen in our own settings where in the early part of the pandemic, there was a shortage of equipment. There was this lack of safety measures, and people were called upon to go into hospital settings and provide the care with very little to actually protect themselves, right? And people are exposed to infection, and in conflict areas, of course, violence. When people go into where there has been a natural disaster, you are exposed to natural dangers. Like, for example, in Nepal, when humanitarian aid workers went in, you didn't know when the next aftershock would happen. You didn't know when the next earthquake would happen. But people still had to go in and put their personal safety at risk. Now, in our times, of course, we are exposing ourselves to infections wherever we go in our settings where we're providing care for patients who are immune compromised or have COVID. Physical stress, we're all pulling long hours. Every single one of us is pulling hours much longer than we normally had. And that does result in things like sleep deprivation, exhaustion. I'm going to ask you, how many of you have eaten 3 square meals right through the last few months? How many of you have seen that pattern change? Where you're so caught up with your work that you say, okay, you know what, I'm just going to have lunch a little bit later. Or, I don't have time to sit down and have a proper meal, so I'm just going to stand here and eat whatever I can get my hands on. Yeah. So how many of you feel that those very simple things that were part and parcel of our routine have changed? Some things that you took for granted during, regular course of work. And but one of the first things that actually, takes a hit is your own routine. And once your routine is disrupted, then everything goes. And of course, now with everyone having to be at home and role responsibilities have changed. Many of us are trying to sit at home, sit in front of a computer, in front of Zoom, and managing our housework while we also manage our deadlines. And the whole dynamic of how we separate our professional and personal lives, all of those things have changed. Yes. So yeah, someone has said we used to think of after reaching home only to have our meals. So those very basic things have been disrupted. And that is something that we don't really think about very much, but they have huge repercussions on our health. Moral and ethical distress. Okay, I'm going to take a few minutes on this one. What I've mentioned there as a sub tag is witnessing disparities and making hard choices and triage. Okay, so I'm going to just take a few minutes, Raju, and I'm going to ask people also to this is not an easy territory to navigate, but I'm just going to spend a few extra minutes on moral and ethical distress. So what happens in a humanitarian crisis sometimes is that usually in the humanitarian aid circles, who are the ones who first get attention? When we go out to provide care, when there is, say, a natural disaster, or when there is, like now, I know that we almost canceled our session today because we weren't sure how the cyclone would hit our headquarters. But when it comes to providing care, usually in humanitarian aid, focus is on whom? Children and senior citizens, people who are suffering. Shala, thank you for that comment. That's a very distressing comment to read. But yeah, I can empathize with you. In triage, focuses on people who can be helped. Thank you, Rajni. Patients, focus on people who are in need. Okay. Here is a little bit of a situation that becomes a little bit tricky, where, do you all remember that in the early part of the pandemic, Italy went through this massive crisis where they had to decide that the ventilators would go to people who were not elderly? They actually came up with a document that defined a cutoff age. Focuses on the ones who are more in need than the others. In that case, Vandana, the first people who should be getting aid are people with palliative care needs. That doesn't really happen, does it? So there is this ongoing, and by no means do I intend to, by no means am I trying to say that we will resolve that discussion. That's going to be an ongoing discussion. But usually when resources are limited, they are allocated to people who have a better chance of survival. Children, young people, those who will benefit the longest. Right? So that's typically how triaging in its traditional sense was done. Who has a better chance of survival and therefore should get access to limited resources. Now, where does that put our patients who are already compromised, who are in advanced stages of cancer, who are bedbound, who probably have a degenerative neurological condition? What happens there? Right? So that can cause a lot of moral and ethical distress in the healthcare community. And that is something that is a source of huge ethical and moral distress. In fact, that was one of the points that caused the most amount of distress to the doctors in Italy also. And I think they finally changed that document. But it is very difficult to decide, Rajni. And the thing is that is something that we cannot dismiss. It does happen. It does happen. If you have a 70-year-old man with comorbidities and a 25-year-old youngster, who is likely to get limited access to, who's going to get access to limited resources? Now, here's another thing. What if you have a 30-year-old person who is who's heavily dependent on drugs? And what if you have a 70-year-old man who still has a lot to teach? Right? So who should be saved? So I'm not asking you to put your answers out. I'm just asking you to think about these things. Yeah. Vandana, I have been actually told when I approach somebody for CSR that they would rather back a winning cause. And by winning cause, they meant somebody, a more life-saving sort of a field, rather than, oh, but in your case, the patients are going to die anyway, right? So why wouldn't I actually fund a project where they're actually looking for a cure? So I've actually had that said to my face, and it's quite sad. Panna, you want to say something?
Yeah, I've actually seen this happening in terms of financial help also. There are times when, I have heard it in person that a palliative patient is going to die anyways. So why would that patient need, it gives me goosebumps when I say that and my heart cringes with pain. But I've seen it, that why would that patient need money or financial support when we can give it to a younger patient? Or a patient whose intent is curative, and yes, which is unfair.
And it's also interdisciplinary in that sense. I would rather fund the education of a child than pay for a palliative care person's needs. So so that sort of conversation happens a lot now. That's just something that I wanted us to spend a little extra time on, because this does happen. It's not going to go away in a hurry. By no means are we looking for answers in today's session, but these are things that are unique stressors in a humanitarian crisis. Other unique stressors also include vicarious trauma. If you are a compassionate person and you see other people suffering, it's bound to hurt you. The pain of witnessing another's suffering. And no matter how skilled we are, how exquisite our training, how much we've been trained to have a little bit of detachment in order to do our jobs, there comes a point when the suffering is on such a great scale that it does impact us. There is a sense of endlessness also. And how many of us have felt that during this time? When is this going to end? When is this going to end? It's been the whole year. It's almost like saying, oh, 2020 is the year. What makes us think it's going to stop on the 31st of December at 11:59? It's not. It's going to carry on well into next year in different ways. So there is a sense of endlessness. And for a lot of us, there's a continuously building workload. We ourselves are unable to stop. There's a sense of guilt. Okay, if I want to take 2 days off for self-care, I'm going to think, oh God, but in these 2 days, so much damage can be done. So I can't stop right now. There is a struggle to place boundaries that we talked about. Witnessing morbidity and disfigurement. And there is unprecedented scale of death. And also, if we notice that the children who are the collateral damage, and in other crises also, when we see children being affected, children, if you look at the refugee crises that happens across the world, if you see the Rohingyas, like Joan Marsden talked about, and she made a very beautiful point of it when she talked about it in her first session on humanitarian crisis. Witnessing all of that has its own trauma associated with it. And there is also isolation. We ourselves as healthcare workers, sometimes to protect our families, we are separated from them. We're separated from our friends. And quite often, especially people who work in settings, in end-of-life care, humanitarian aid, kind of work that we do does not often lend itself very well to dinner time conversation. It's just when you work in this kind of line of work, like asked, how was your day today? What was your day like? We oftentimes protect our family members because we don't want to tell them how many small children we saw dying, or how we were able to control somebody's pain and give them some pain relief. Okay, that is something that I might be able to talk about. But by and large, even within our own families, because of the work that we do, it is isolating. It's not something that we can make a real big joke about it and make people laugh with some stories. I mean, there might be the odd good humored story, but then most of the time we're isolated within our own families as well. Also, what we see in a humanitarian crisis is sudden lack of autonomy. Because things are happening and they have to happen at a particular pace. We have to follow, certain protocols without question. And that might happen when we have differing values. And sometimes our leadership is not exactly competent sometimes. So that can cause a lot of distress as well, right? Because if we're so time bound, there's no time to sit and debate and say, okay, play the devil's advocate. If we do this, then we can do this. If we don't do that, then this will happen. Because we don't have that kind of time. We have to make decisions really, really quick. And you can see that also in the way the guidelines around the world are changing from week to week, day to day. Team-related stressors. Suddenly we find ourselves where we have to recalibrate the entire team. Different people have to take on different roles. And for a while, there is role clarity is lacking. And that causes confusion. Is that my job? Should I be doing this, or should somebody else be doing it? It's something brand new. We ourselves in Pallium, when the pandemic first hit, we had to reorganize all our services. Who will take charge of what? And it was a challenge for us, even though we're a team that has been cohesive for so many years. We all know each other, there were systems in place, but suddenly the systems did not serve the purpose and had to be changed. And those kind of decisions had to be made very, very quick. And that can cause some stress, that can cause some friction. Existential suffering. What is the meaning of all of this? And I have personally spoken with so many doctors who have said, I don't know why I'm doing this work anymore. You know, like I can't even leave home to go to the hospital without my neighbors staring at me and saying, oh, you know, she's going to bring COVID back to this locality. And there are people who've experienced that kind of stigma, which has also made them question why they're serving the people that they serve. Because rather than, I mean, forget gratitude, they're actually being punished for it and socially ostracized for it. So that's one aspect. The other aspect is sometimes just seeing so much suffering around you, you just wonder what is the, you know, what is the purpose of all of this? And is my doing anything going to make any difference to anybody? And finally, there are challenges in measuring and reducing suffering, right? For those of us who have been in healthcare a while, we know about evidence-based research. We know that things have to be documented. We probably need to monitor and evaluate our responses. And perhaps that way, when the next time we have this sort of a trauma, I mean, we have this kind of a crisis on us, then we know how we should go back to reorganizing ourselves and so on and so forth. But then when the crisis hits, there's very little time to actually to do that kind of documentation or to do that kind of monitoring. And you know, something like number of deaths versus quality of death. We know that a lot of people are dying, but do we know what quality of death they've had? And these are things that are very unique to a humanitarian crisis. So before I go into trauma, into the section about trauma, I'm just going to take a couple of minutes to go over the chat box to see if there are any comments that anybody has shared. My son says your work is depressing. Yeah, I've been told by friends. My nickname amongst a lot of my friends is Grim Reaper, which is basically a Western version of trauma. And I've been told that on an average, if I enter a social gathering, within about 12 minutes, I start talking about death and dying in palliative care. So that's a running joke amongst my friends. But yeah, a lot of the times when someone asks me at a gathering, what do you do? I really hesitate because I know that the conversation is going to go in a completely different direction after that. And I really don't want to, I mean, I try and talk about how it is an uplifting field that I'm in, but it takes me a while to get to that point. And then, you know, someone will say, oh, she works in palliative care. You know what, let's not get into that right now. So yeah. So any comments on some of these things that we've just talked about? Moral distress, issues with authority, issues with following orders from people whose values might be different, guidelines that we don't really, you know, like now, for example, not being present for funeral rites, not being able to say goodbye to our loved ones, not being able to, or being in that position where you have to facilitate some sort of final contact between the patient's families who are not allowed to meet the patient, things like that. So these are terrible guidelines to get used to, but they are there for our protection and safety. But they're so far removed from humanity also. Okay, so just being mindful of the time. Relates to all of us. Yes. Okay, so I'm going to just talk about trauma. And trauma very often is understood. How do you all see trauma? What does the word trauma bring up in you? When I say the word trauma, what is the first thing that you all think about? I'm just going to wait a few minutes to let people give this some thought. Fear and pain. Do you associate trauma with particular kinds of experiences? Injury, mental or bodily, yeah. Accident, shocking incident. A lot of the time I used to associate it with childhood trauma, things that we experience in our childhood, but that's a very therapy lens. Panic, distressing and disturbing. Mental stress. Okay, so talk about trauma. Now, the trauma is something that is experienced when you are exposed to a non-normative, something that is abnormal, and it is over a particular period of time. Okay, so trauma is something that results from exposure to a non-normative experience, which leads to a profoundly dysregulated nervous system. So I'm going to take some time over this slide because each of these boxes has a heavy concept. So trauma, like all of you have said, is pain, it's distress, it's shock, it's all of those things that results from exposure to a non-normative experience that results in a profoundly dysregulated nervous system. So when your nervous system gets dysregulated, it can create a sense of extreme fear, which can then manifest in nightmares, it can manifest in dysfunctional behavior, it can in dysregulated responses to our environment, and so on and so forth. And it shatters our assumptive world. Now, what do we mean by assumptive world? As we grow up, as we become adults, as we go through different experiences in our lives, we tend to put together a mental map of the world based on our experiences, based on what we're taught, based on what we learn, what we study, what our professions teach us. And it's like this jigsaw puzzle that is constantly being put together. So if I do this, this is going to happen. If this happens, then that will happen. So the human mind has a tendency to give order to things. And we like to draw logical sort of lines through things, even if they are actually illogical. But we like to believe that there is a certain sequelae of events that will happen if this happens, and so on and so forth. So that is our assumptive world, that this is my assumption of the world. And then when we experience trauma, that assumption is shattered. And we see and hear and feel and experience things that were not part of our mental map. So therefore, we don't have adequate skills to compensate for it or to deal with it or to cope with it. So this is how trauma normally pans out. And I'm just going to let that slide be there for a couple of seconds longer. So this is pretty much the sequelae of trauma. As with any kind of distress or any kind of human experience, I won't even say distress, any kind of human experience, trauma manifests physically, cognitively, emotionally, and existentially. So that basically means physical, mental, emotional, and spiritual. And therefore can have these different constellation of symptoms: numbness, in affect. Substance use keeps coming up because substance use, there is a huge upsurge of substance use across the world ever since the pandemic began. And substance use, addiction are very, very directly correlated to trauma. And I'm also going to ask you at this point, Shreya, you can put it in the chat box. It's Gabor Mate's book. It's called In the Realm of Hungry Ghosts. It is a seminal book on addiction and trauma and the socio-political and individual and cultural aspects of trauma that impact addiction. It's a book that personally changed my worldview on a lot of things. PTSD is a manifestation, demoralization, like we see in burnout, loss of meaning, acute anxiety. So there's a lot of constellation of symptoms that actually map very closely to some of the other things that we've talked about. So that's why I wanted to make the distinction between burnout, distress, and trauma, because there are many overlapping factors. But one thing I'd like you all to remember is that a trauma response is a normal response to an abnormal situation. Okay, so let's go over that sentence again. Trauma response is increasingly recognized as a normal response to an abnormal situation. If you experience a situation that is so outside of your normal life in a negative way, it would be unnatural for you to not be traumatized by it. A painful experience that is so outside of your normal assumptive world. If you think about, people losing their homes, to floods, to earthquakes, to anything, a refugee crisis, conflict, war, people even losing their identification papers, or people, not having access to basics like food, water, shelter, to medicines, or witnessing suffering of the kind that we've never seen before. Lying in a hospital bed, getting treated for COVID, and seeing people next to you just being taken away once they've passed away. Now, all of these warrant that you experience trauma. So what I'm trying to say here, and what the experts are saying, is that trauma is a normal response to an abnormal situation. So here's where this absolutely beautiful word comes in, resilience. Resilience is something that we usually attribute to children. We say children are so resilient. And more when we experience traumatic situations, it's the human resilience that we are called to build on. And what is resilience? Resilience is the ability to respond to stress in an adaptive way. I have to adapt to this. Okay, it is the ability to bounce back, to go through an extremely traumatic experience, but to rebuild your life from that, no matter how long it takes, and how quickly one is able to recover from adversity. Now, I just want to mention that you're not a better human being if you, recover faster. But resilience does sort of go into that domain of recovering from adversity. So resilience is something that is given a pride of place in trauma-informed response. And I'm just going to take a minute here to share with you some of the resilience building practices that we can do for ourselves in a situation of high crisis. So it doesn't have to be like it's not that you're standing in the middle of an earthquake struck region, but even now in our lives, we are experiencing trauma. And what are some of the things that you can do as individuals for yourselves? The first is a moment of self-compassion, where you need to actually tell yourself that I am doing my best in this difficult situation, and that is good enough. That self-compassion, even though that is a very simple sentence, it is a very powerful sentence, and I urge you to use it as a mantra, because things of inadequacy that a lot of us face, we're not doing enough, we're feeling helpless. I've seen the word helpless show up in the chat box a number of times. But there are other ways in which you can help. And there are other things that you're doing. Even actually keeping your own home running as normally as possible, giving your own children a sense of normalcy is a massive accomplishment in these times. So doing that is good enough for now. There is something called practicing the pause. Just stop right now, even right now, in the middle of this whole exercise. I'm going to ask you to just stop for a second and take a moment to take a deep breath. And put your feet on the ground and make sure that the soles of your feet can feel the ground fully. So just taking that moment, it's called practicing the pause. Learn to take that pause, and you can do that anywhere. You can do that in the middle of a Zoom session. You can do that in the middle of a walk. You can do that in the middle of like a chaotic household morning. Just take that one moment to stop and practice the pause. Grounding exercises like taking a few moments to notice your physical self. There is something called interoception. About introspection, there is something called interoception, which is internally scanning your body. See where the tension in your body is. Are your shoulders tight? Relax them. Jaw tight. Is there tension in your arms or in your calves? Release it. And then again, there is a lot to be said about placing your feet fully on the ground, both next to each other, and break that circuit of tension. And there is something beautiful called attention management. We've all heard about time management, and we all aspire to be better time managers, but I will now urge you to manage your attention better. And when there is a crisis situation on, if you just take a moment to shift your attention to something that is neutral, it could be the cup of coffee in front of you. It could be your dog that is taking a nap near the sofa. It could be a potted plant on your windowsill. So just shift your attention to something that is not volatile, not charged in that moment, and it will help you break the cycle of tension. The other thing about attention management is what you choose to give your attention to. Now, I know mindfulness practices, no matter what we do, we have to do it with our 100%. Intentional attention management actually tells you that not everything needs your 100% attention. If you're doing something that requires 10% of your attention, give it 10% of your attention. Don't overstretch yourself at a time of crisis. So these are some of the most basic resiliency practices. I'm sure each of you have your own. Maybe you just don't call it a resiliency practice, but it is something that gives you some amount of peace and release and relief in a time of high crisis. And I'd like to discuss that a little bit more once we finish the PowerPoint. But there are also resiliency practices that you can do for yourself as well as for the team. Now, when there is a crisis on, that is really not the time to sit and think about some Zen practice that you learned a long time ago and give yourself half an hour to practice it. You can't. It may not be the time to really take time off and stuff. So just brief debriefing, events, experiences. I might go to Shreya and say, oh God, you know, Shreya, that particular moment with that man, that really affected me. It's just to acknowledge that something affected me. And Shreya might say, that seemed really hard. So just recognize each other's emotional experience. Or she might say, you know, I'm a little bit overwhelmed right now. So I might give her 5 minutes off and say, you know what, why don't you take a break? Let me handle this. So those are very brief debriefings we do amongst each other. Acknowledge emotions and name the emotion. Naming the emotion can really go in helping us build resiliency. Even if it means, you know, I'm a little bit angry at the moment because I don't like what I just saw. Or I wish I weren't feeling so sad. It's really compromising my ability to take, or things like that. The short mindful practices that I just shared with you, those are great practices to just spend less than 5 minutes on, and it should be able to help you set some sort of a reset button. And self-compassion, of course. As a team, debrief is really important at a time of crisis. Even if it could be just 5 minutes or it could be 30 minutes. But encourage your team to get together at a certain frequency every week, or even 5 minutes at the end of every day. Or we don't call it a debrief, but we do have in our team, we meet every Monday morning to set our goals, and that meeting lasts an hour and a half. And then we meet for about an hour on Saturday to see how the week went for all of us. And while it is usually a task-oriented exercise, we do also end up talking about some of the challenges. And sometimes we actually end up laughing a little bit, which is a great sense of relief for us, right? So that is something that we bookend our week like that. So we may not call it a debrief, but it's a kind of a debrief. Your debriefing is important to remain respectful. in your communication and be inclusive. And what is not written here is something that I will say that if somebody is flailing at a task, then be okay to pass the task on to somebody else, right? But that's the kind of inclusivity that needs to happen. You have to model vulnerability. Very often, us as healthcare providers, we don't want to be vulnerable. Someone said we put up a brave front. And yes, we most often put on a brave front. But vulnerability, and especially amongst leadership, to demonstrate vulnerability, I think is very, very powerful. To say that this has been a very difficult time, even for me. And if I'm okay to share my vulnerability, then it will give other people, it'll give permission to other people to share their vulnerability. And that's really important. You don't have to do that in a professional setting. You can actually form an informal group where you do something like that. But demonstrating and modeling vulnerability is very important. And very important, in a time of crisis, we're so quick to point out what is going wrong. We forget to give thanks or to acknowledge what is going right. So talk about what the team has done well. What was some of the barriers we overcame together? What are some of the challenges that were handled, even if they were small or big or whatever? Appreciate individuals within the team. And that culture of gratitude does actually go a long way. There is something called appreciative inquiry, where you have prompts, where you prompt the team to say something nice about one another. You know, my team gave me strength to do XYZ, or something positive I learned from the team this week was XYZ. So appreciation affirmations are really positive ways to counter the trauma that we experience in crisis. Now, this might be a very premature slide because we're still in 2020, but once the crisis is over, and I don't mean once the pandemic is over, even when a smaller crisis is over, when the crisis for the day is over, or the crisis for the week is over, make some space to process grief and trauma, and to acknowledge that even amongst us, there are people who are grieving, that we are experiencing trauma. We've now talked about the red flags. We've talked about emotional exhaustion. We've talked about burnout. Are you seeing this in your teams? If so, then this is the time to sort of also pay attention to it so it doesn't get worse. Encourage reflective practices. And while we do this, while some of us might be really great at doing this for ourselves, also encourage your teammates to have some sort of creative expression, whether it's through writing, storytelling, whatever else, and facilitate post-traumatic growth, share experiences, educate others to prepare. You might have found a new way in which someone talked about the fact that you learned that you can stretch yourself. What enabled you to do that? Where did you find, where did you find support? Where did you find your sense of resilience? And once you share that with people and educate others, it might be something they never thought about. Now, this is a question that I'm just going to put out there, and we'll have a discussion on it for a few minutes. What has this pandemic really taught us? Does our system need an overhaul? And what can we as individuals do to make the system better? We might feel that, hey, I'm just an employee here, or I'm not really in the decision-making circles or whatever. But changes can be both top-down and bottom-up. So we've learned a lot from this pandemic. We're continuing to learn. And what are some of the things that we've learned? Just like we as humans need to be resilient, so does our healthcare system. And we're at a point now where a lot of people out there are wondering about how can we make our systems more resilient. Worldwide, whether they're in low or middle income countries or high-end countries, healthcare systems are crumbling. And it is time for us to think about how the system needs to be overhauled. And finally, I'm going to just leave you with these two quotes, that we have a moral obligation to ensure that we are not sacrificing our own at the altar of care for others in great need. So we need to look after ourselves. We need to look after our teams. We need to look after one another. And a very simple statement is, you cannot pour from an empty cup. So while all of us have this great need and desire to be of service, unless we look after ourselves, we really won't be able to do that. So I am going to, we are now at the end of the PowerPoint. I see someone saying that they landed up with cheek biting and lip biting, but at least you became aware of that. You've stopped guided meditation. Okay. Treating your team at the restaurant to acknowledge their efforts. Lovely. At a time when we're separated from a lot of our loved ones, I think we stand in as family for one another. So even these small gestures make a big difference. So please feel free to, we have 15 minutes and I would really like to hear from all of you. Please feel free to unmute yourselves. Well, yeah, Vikas, I think that, not everything is for everyone. I tried transcendental meditation and I kept falling asleep. And that's something I actually believe in a lot. So I was really disappointed in myself because I felt that I couldn't do it. But then there comes a point where maybe some things work and some things don't. So I feel like we all have to work with what we can, and something might work for someone else. If it doesn't work for me, it doesn't work for me. It's fine. Yeah, we all some people like to work out and like do some heavy lifting and all of that. That works for them to burn some residual energy. Some people like to watch movies. Some people like to actually step out of their minds rather than go further inward. So whatever works for all of you, it's I think we're all individually tailored. Yeah, so please feel free to unmute yourselves. Happy to hear. Is there a difference between existential and spirituality? Very intertwined, I would say, Mosmi. Existential is, okay, why do I exist? What is my place in the world? And it's very deeply tied to spiritual. So I wouldn't say the two are entirely different. It's what, so when we say existential crisis, I would say that it's, it is a spiritual crisis in a sense. And spirituality, again, it includes, but is not restricted to religious identification. So I might not be a religious person, but I might be a spiritual one who finds their meaning and sense of hope and connectivity with other humans, with other people, with music, with art, with nature, whatever it is. So I think existential also has an element of purpose in it. Why am I here? What am I doing? Am I making a difference? So there is that little bit of a difference between, complete spirituality and. I'm very glad you're very resilient also, Rajni. I think, oh, don't feel inadequate. See, the thing is, I suppose that's why we're all here, to share our learnings with each other. And I really want to say that so much of what I shared with you today has come from a wonderful colleague called Dina Joseph, who is in the US. She was the head of wellness. She was the associate professor of wellness at UCSF. And so, I mean, I've quoted a lot. I mean, a lot of the stuff that I've shared with you today is in the field manual for palliative care and humanitarian crisis. I'd shared the link with all of you a couple of sessions ago in the first humanitarian crisis session that Joan took. So please go back to it, look at the trauma-informed response chapter. You'll find that almost everything I've shared with you today, you'll find the longer format of it in that chapter. I think that is the purpose of resilience practices, Vikas, to prepare us for the next challenge. Yeah, we'll share the link again. Shreya, we have the link for, yeah, there you go. Good point of view, Vikas. I think these value judgments that we apply, whether we are successful or not, whether this is a failure or not, I think those are a bit outdated and actually really don't have a place in self-care routines or personal growth practices. You can call them resilience practices. You can call them, self-care practices, whatever it is. But I really don't think it's a formula. Different people come up with their own formulas which work for themselves. And sometimes we outgrow our own formulas, and that's fine. Is resilience inbuilt or we have to inculcate it in ourselves? It's both. I think, I think resilience, fortitude, we're all born with some measure of it. And it's really what we pay attention to. Like, there's that story of the man who had two wolves fighting in him. And was a kind, compassionate wolf, and one was a hateful, aggressive wolf. And then, the little grandson says, which wolf won? And then the old man says, the one he fed. So it's really what you feed and practice. And I think practice is what makes us better at a particular, whether it's a trait. So I would say that it's like when you go to the gym and you work out, and if you're only working out your arms, not the rest of your body, when you're in a crisis situation, you're likely to use your arms because that's the strongest. So similarly, mentally, emotionally, it's what we pay attention to and the practices that we constantly give our time and effort to. Those are the practices that really become our second nature after all. So we're done a little bit ahead of time. That's a lot of information that we had today, I'm sure. The PowerPoint and other stuff will be shared with you. And I'm sure if you have questions that emerge later, you can write into Raju and Manisha, and I'll be happy to answer any of those questions. I just want to say that I'm not a trauma expert in humanitarian crisis, but I have very good teachers who I'm constantly learning from. And I suppose, like all of us, we're just evolving as we go along. So I'll do my best to answer any questions anyone has beyond this session. And if not, I will signpost you to people who are far better informed than I am.
Thank you, Smriti. Thank you for that great presentation. Sorry I was late, but thank you. And thank you for sharing your experiences and how you practice resilience as well. And as a team, we are all asking, when is our treat? When is our treat for? So anyhow, coming back to that.
For the great work that you guys do. Yeah. I'm coming to Trivandrum soon.
But yeah, over to you, Manisha. Thank you so much, Smriti.
Thank you so much, ma'am.
Thank you. Thank you.